Now, when somebody gets depressed and then gets psychotic, a lot of times the psychosis will go along with the depressive theme. Okay, so maybe it's it's feeling like you're responsible for a loved one's death, for instance, and that's a delusion. I mean, you didn't cause the loved one to die, but they died, and in your mind, you did something to cause it, and that could be a delusion. Being punished for some perceived wrong, like this gentleman in the example I gave, he feels like he's done something wrong and he's being punished for it. Probably he hasn't. I mean, and as you'll see when we talk about what happened at the end, he gets better, and that thought gets better. So another one is like the body. Your body is rotting away. That's another one. If you see somebody that has that kind of complaint, you got to wonder about depression, major depression causing that. Being bankrupt is another symptom that can occur with depression that causes psychosis. And the person really has plenty of money, and talk to the spouse or the family, and they have plenty of money, but they are convinced that they're going into bankruptcy. Usually, the way this psychotic depression is treated is you definitely have to use some type of medical treatment. Psychotherapy alone probably isn't going to work, at least in the beginning. Certainly, I would recommend psychotherapy once the psychosis is cleared up some. But when they're psychotic, believe me, I've tried this. You can try to convince them over and over again that what they think is not true, but all they do is they get very angry with you, and they don't want to talk to you anymore. Because it's sort of like me trying to convince you guys that I'm not standing up here right now. There's somebody next to you saying that. What do you mean? Dr. Henley's up there? I don't see anything. I don't know what you're talking about. Eventually, you guys are going to get kind of upset about that because you're going to say, well, he's right there. What are you talking about? So that's sort of the same thing. When somebody's psychotic, it doesn't do a lot of good really to argue with them. But it's better to just, to try to calm them down or distract them away and talk about something different if you can. That's difficult too. So you really need medication or ECT. First, let's talk about medication. Medication would be, medicine for the depression, but you probably also need something for the psychosis, an antipsychotic medicine and an antidepressant medicine. Usually, that's sort of what most doctors would do, is start both of those medicines. If the psychosis is kind of mild and not really interfering with their function so badly, then some doctors would start an antidepressant only and give that some time to work. The other thing is, and so that's okay if the psychosis isn't too bad. But if the psychosis is kind of bad and it's interfering with the person, eating and they're losing a lot of weight and things like that, then you probably need medicine for the psychosis. The other treatment that's very good for this is ECT. It's electroconvulsive therapy. Some people call it shock therapy. I don't really like that because it sounds like we're torturing someone, and we're really not torturing them. But especially in an elderly person, older folks with psychotic depression, older folks are a little bit more frail in general, so they can't afford to lose a bunch of weight, for instance. They're more frail overall, and I think we all know that. But with the medicines, it takes them a while to work. 2 weeks for any benefit at all usually, and then 4 to 6 to 8 weeks for full effect, and sometimes 10 to 12 for the absolute full effect. So that's a long time to wait if somebody's not eating and they're losing a bunch of weight, especially if they're elderly. So ECT sometimes becomes a first line of treatment. In this particular case, after one trial of an antidepressant medication, the patient was not improving, and there wasn't time for another trial because we decided that wasn't. We didn't have the luxury of time. The weight was dropping off really quickly, and we were afraid this gentleman was going to end up in the nursing home or somewhere in the hospital. So he was hospitalized acutely for ECT, and he received 6 to 7 treatments, and the psychotic depression was put into full remission. And in this case, the whole thought of him being condemned to die by God and for sinning by seeking medical treatment, this whole thing went away. And he felt more comfortable about seeking treatment. His depression lifted, and he came back to baseline. The antidepressant medication was started after the ECT and was maintained to prevent him from getting depressed and psychotic again. Ideally, if you can prevent the depression, a lot of folks think that then therefore you'll prevent the psychosis too. So you may not need the antipsychotic medicine the whole time if you ended up using that. Any questions about psychotic depression? Anybody ever heard of anybody like that, or having treated a case like that before, or anything? No? Okay. So the next type of depression is seasonal affective disorder. Okay, that one is it's a kind of an interesting disorder, really. It's let me give you a case first, and then we'll talk some more about it. But this one hypothetical case is a middle-aged female with no history of mania or hypomania, so probably no bipolar disorder that we know of, who becomes clinically depressed in the fall every year for the past 5 years, just in the fall. Okay. The episodes lift in the spring every year without treatment, and she's tried antidepressant medicine for the past 2 years, but the episodes seem to be getting worse with the treatment rather than better. So what is this? Okay, seasonal affective disorder is when you get remember the depression symptoms we talked about. If you get those same symptoms, and they occur, seasonally, and really in the books and stuff, it doesn't say that it has to be in the fall and winter, but mostly that's what it is. But if it occurs in the fall, if it occurs seasonally like that, the depression, and it doesn't occur in the other seasons, so for instance, in this case, the person gets depressed in the fall and winter, but not in the summer. And as long as you haven't had as long as your mood is seasonal like that for at least 2 years, you can make the diagnosis of seasonal affective disorder. Incidentally, seasonal affective disorder, affective means mood, so seasonal mood disorder is what this is. And the reason it says mood is because really you can have bipolar disorder, and a lot of folks that do have bipolar disorder, it is seasonal. What you'll see is these folks get depressed in the fall and winter, and then as the spring comes in, they start to get more hypomanic or manic. So springtime, the psychiatric units are full because folks, they get more manic during that time. Now, I want you to think for a second about this, because how many of you out there, I'll admit, I'll raise my hand, in the winter months, what happens? As the fall and the winter, and right now, what are we dealing with? We're dealing with kind of short days. There's not very much daylight. What daylight we have is muted, right? It's cloudy, it's dark. There's some days that I'm at work and it looks like, I look out the window and it looks like it's dark, but it's the middle of the day. All of us, I think, experience some degree of a lower mood during these months. And we've talked in here before about, I think that my theory is that some of these illnesses are really just along a spectrum. We all have moods, obviously. All of our moods fluctuate day to day, and certain things can change our moods, right? Some people end up with a full-blown mood disorder, meaning it interferes with their function. Other people just kind of get down. Doesn't really interfere with their function too much, but they just are more down in the winter months. Now, one of the interesting things I think about this disorder is really when you look at the symptoms of it, they sort of look like hibernation symptoms. What do? We crave sweets. We want to sleep all the time. It's hard to get out of bed, right? In the winter, how easy to get? I don't know. It's hard for me to get up in the winter. So I think it's the same for a lot of us. And I think our bodies have a tendency, and there's some biology behind it. I'll talk about it in a second. But I think our bodies have a tendency to want to withdraw and almost hibernate when it's cold and the days are short and it's so cloudy. So if you take that and you magnify that into a full-blown mood disorder, that's probably what seasonal affective disorder is. Now, the one thing to be aware of or to look for is you want to make sure that there's not some recurring stressor every fall or every whatever season it is that these moods kick in. So if it's somebody who has to go to school every year and they're getting depressed because of school, that's a little hard to sort out, I suppose. So, or if they have a seasonal job and they're unemployed for certain months and they start to get depressed every time they get unemployed, that may not be seasonal. It may be seasonal, but it's probably related. It may be related to the stressor or the job loss or whatever. So you got to keep that in mind too. But interestingly enough, this sort of makes some sense. Is that this disorder is much more common in northern latitudes, right? So you go down to the equator. Not a lot of people have this. Why is that? Well, again, maybe because of the sun, right? Maybe they have a little nicer days than we have up here. So I've had patients who have spent winters in Florida and places where it's warm and sunny out, and it sort of takes care of their problem. They don't have so much trouble with the moods anymore. So that's right. Yeah, I need to write a script for everybody. Everybody goes to a warm climate in the winter months. Indiana would be, or Hagerstown, or the area here would be